Leukemia, an in-depth exploration. Leukemia, a complex and multifaceted disease, stands as one of the most challenging forms of cancer affecting the blood and bone marrow. Characterized by the abnormal production and accumulation of white blood cells, leukemia disrupts the body's ability to produce healthy blood cells, leading to severe health complications. This video delves into the types, causes, symptoms, diagnosis, treatment, and prognosis of leukemia, highlighting the ongoing efforts in medical research to combat this formidable disease. Types of leukemia. Leukemia is broadly classified into four main types, distinguished by the speed of progression and the specific type of white blood cells affected. 1. Acute lymphoblastic leukemia, all predominantly affecting children but also seen in adults. ALL is a rapidly progressing form of leukemia that targets lymphoid cells, crucial components of the immune system. The swift progression of ALL necessitates immediate and aggressive treatment. Point 2. Acute myeloid leukemia, AML. AML primarily affects adults and is characterized by its rapid progression. This form of leukemia involves myeloid cells, which are essential for the formation of red blood cells, white blood cells, and platelets. AML requires prompt intervention to manage its aggressive nature. Point 3. Chronic lymphocytic leukemia, CLL. CLL is the most common form of leukemia in adults, especially those over the age of 55. Unlike acute leukemias, CLL progresses slowly and affects lymphoid cells. Due to its slow progression, patients may live with the disease for many years, often requiring periodic monitoring and treatment. Point 4. Chronic myeloid leukemia, CML, occurring mainly in adults, CML progresses slowly and affects myeloid cells. This form of leukemia is often detected through routine blood tests before symptoms appear, allowing for early intervention and management. Causes and risk factors. The etiology of leukemia remains largely enigmatic, with no definitive cause identified. However, several risk factors have been associated with an increased likelihood of developing the disease. Genetic disorders. Conditions such as Down syndrome are linked to a higher risk of leukemia. Family history. A family history of leukemia may elevate the risk. Previous cancer treatments. Chemotherapy and radiation therapy for other cancers can increase the risk of developing leukemia. Exposure to radiation and chemicals. High levels of radiation and certain chemicals, like benzene, are known. Risk factors. Smoking. Tobacco use is associated with an increased risk of leukemia. Symptoms. The symptoms of leukemia are diverse and can vary depending on the type and stage of the disease. Common symptoms include fatigue and weakness due to the lack of healthy red blood cells, frequent infections resulting from a shortage of normal white blood cells, unexplained weight loss, a common cancer-related symptom, swollen lymph nodes, liver, or spleen, indicative of the disease spreading, easy bruising or bleeding due to a low platelet count, fever or chills, often linked to infections or the disease itself. Bone or joint pain resulting from the overcrowding of bone marrow with abnormal cells. Night sweats, a symptom often associated with many cancers, including leukemia. Diagnosis. Diagnosing leukemia involves a combination of medical history evaluation, physical examinations, and a series of laboratory tests. Key diagnostic procedures include blood tests. These check the levels of white blood cells, red blood cells, and platelets. Bone marrow biopsy. This involves extracting and examining bone marrow to identify abnormal cells. Genetic tests. These are used to detect specific genetic mutations associated with leukemia. Treatment. Treatment strategies for leukemia are diverse and tailored to the type and stage of the disease, as well as the patient's overall health. Common treatments include chemotherapy, the primary treatment for most leukemia, involving the use of drugs to kill cancer cells. Radiation therapy. High-energy radiation is used to destroy cancerous cells. Targeted therapy, drugs specifically designed to target abnormalities within cancer cells. Immunotherapy, treatments that enhance the body's immune system to fight cancer. Stem cell transplant. This involves replacing diseased bone marrow with healthy stem cells from a donor. Clinical trials. Participation in research studies to access new and experimental treatments. Prognosis. The prognosis for leukemia patients varies widely based on several factors, including the type of leukemia, the patient's age, and their overall health. Advances in medical research and treatment have significantly improved survival rates, especially for children with certain types of leukemia. However, the journey through treatment and recovery can be arduous. requiring continuous medical support and follow-up care. Finally, leukemia remains a formidable adversary in the realm of oncology, presenting significant challenges to patients and healthcare providers alike. However, through relentless research and advancements in medical technology, the fight against leukemia continues to gain ground. Understanding the complexities of leukemia, from its types and causes to its symptoms, diagnosis, and treatment, is crucial in the ongoing battle to improve patient outcomes and ultimately find a cure for this devastating disease.